Any man that desires to have the most reliable, permanent, and liberating solution for their erectile dysfunction and can undergo a short procedure under a general anesthetic is a good candidate for a penile implant. It is true that Medicare, as well as several major insurance carriers, do cover the penile implant surgery. However, first I would like for my office to check for you before we proceed with the surgery. Importantly, if insurance coverage is not an option, I do offer cash-based prices for this surgery. In general, there are two types of implants available on the market. One is called a malleable or a semi-rigid implant, and the other is called a three-piece inflatable penile prosthesis. A good comparison or analogy for these implants would be a Toyota Corolla versus a Mercedes-Benz. My opinion is that if a man is able to have an inflatable implant, I will almost 100% recommend that every time. Operating a penile implant is actually really quite simple. With a malleable device, you can simply bend it down when you're not sexually active, and then bend it up when you are sexually active. When it comes to using the inflatable penile prosthesis, it's also quite simple. You have the power of activating the device at your fingertips. There is a small pump that sits inside your scrotum, which you're able to use in order to generate a firm erection. I think this is a very important question. What I want all men to know is the penile implant does not affect your desire for sex. It does not affect your sensation during sex, and it does not affect your ability to climax or ejaculate. It simply gives you the power of having an erection when you want it and as long as you want it. Yes, the implant is absolutely 100% concealed. I want you to remember that, when you're in the locker room having a shower, no other person's ever going to recognize that you've got an implant. When you're going through security at the airport, the metal detectors are not going to go off. So yes, it is 100% concealed. So the Coloplast implant is actually made up of polyurethane. This material is completely biofriendly and harmless. The penile implant procedure is about a 30-minute to 1 hour procedure that's done in an outpatient setting, which means you go home the very same day. It's done through a small incision either above the penis or between the penis and the scrotum. I may decide to leave a small drain as well, which you would go home with. As with most surgeries, the recovery varies from person to person. In general, you're going to be sore and going to want to rest for about 7 to 10 days. By week 2, you should be able to resume most, if not all, your normal activities. And by week 3, I assume that you're going to be doing all of your normal activities. Now, for the first week, you're sore, but that doesn't mean you're laid up in bed. I do want you to be up and around doing most things in the house by the following day. Now, just because you've recovered quickly from the surgery doesn't mean that you're ready to use the device. I want you to completely heal from the inside for about 4 to 6 weeks, and that's when I allow you to completely use the device with all the freedom. As the saying goes, nothing lasts forever. I want you to remember that this is a mechanical device, and data shows that this device lasts on average about 10 years. With that said, I've seen guys that have had their device last for over 20 years, and I've seen guys that have failed their device within the first 2 years. The most important thing that I can tell you is to keep using the device. It's kind of like having a nice fancy car. If you don't run the engine enough, it's going to catch some rust, so keep using the device. Now, the penile implant has been around for over 50 years, so it's no newfangled device. And so we have all the data and all the research behind it. And all the data shows that the penile implant is really the only treatment for erectile dysfunction that has a satisfaction rate greater than 90 to 92% amongst both the patients and, more importantly, their partners. Now, I've made the penile implant sound like the perfect answer for every man, and it is for a lot of men, but there are some risks that I have to inform you about, and perhaps the most critical of them is the risk of an infection. Anytime a foreign body is placed inside of you, there is a very small risk of an infection. That risk, thankfully, is very, very low with a penile implant, and I do everything I can in order to prevent an infection.